thanks everybody for coming along today to listen to this webinar. So I'm going to talk a little bit about the work that has been done in our group and our kind of future plans within our area. I'll go through a few kind of case studies of some of the projects we've done in the last sort of couple of months that have been published, so you can see kind of the new things we've been up to as a group. So firstly, just to cover a little bit about why our research matters. So we've been doing over the last couple of years, we've been predominantly working in the area of health and work. So looking at the impact of particular life events, health conditions and health interventions on labour market outcomes. And this has been really driven by kind of the government interest in this topic. There was the Get Britain Working white paper, which identified the need to reverse the increase in economic inactivity due to ill health. And also the Kickstart Economic Growth Mission, which was a key mission of the new Labour government recently. And there's been a commitment from the government across different policy papers that they've published around things like talking therapies and the individual placement and support service to kind of expand those services to support people with mental ill health and improve labour market outcomes. And there's obviously quite a huge sort of cross-government policy interest in this area of work as well. So just to cover what I'll be going over in the slides. So I'm going to present first a little bit around the unique data capability we have in ONS to conduct the work we do. I'll then cover a few case studies on how we have achieved the impact we have with the work we've done, how we work to kind of amplify that impact, and then also what's next for us. So the challenge really across the kind of spectrum of this area of work is that a lot of the data is collected through different departments, and so that having sort of fragmented data really limits the insights that can be brought from when we can combine this data. And health and economic data previously have been historically siloed into different departments. So obviously the health data broadly collected by NHS England, and the economic data more sits in HMRC and DWP. So the solution for us is being able to link those two things together to really expand the kind of data capability we have in ONS for a cross-government need. And it's meant that we've been really uniquely positioned in ONS to be able to conduct this analysis that we have been doing for government policy purposes. So just to demonstrate a little bit about the data that we do hold currently within ONS that we're able to link together. So it all centres around our kind of population spine and where we get all of our sort of socio-demographic characteristics, which comes from the censuses. So we've got the 2011 and the 2021 censuses that we can use. And we're able to link on to the census. We have health data, which is quite a list now of data that we hold, covering hospital records, talking therapies, maternity services, community services. And we can also link on our ONS birth and death registrations, which are very important for us to incorporate into our analysis. Labour market data in the form of HMRC PAYE records currently and DWP benefits data. And we're exploring at the moment how we can incorporate self-assessment data as well into our releases. Because at the moment, what we have managed to do in the space is look at those who are being paid via PAYE, so they're employed by an employer. And so we are aware that we have limitations with that work for people that are self-employed. So that's an area of focus for us, is to try and see how we can incorporate some self-assessment data into our work to be able to look across a broader kind of spectrum of outcomes. And we're also looking at how we can now start to incorporate education data into our work as well. And I'll cover off when I talk about our sort of plan for this financial year, what it is we're doing with that at the moment. So just to give a bit of an overview as well, how we kind of work within our analysis unit. So we have quite a lot of kind of collaborations across government and beyond. So we work quite closely with other government departments, and they come to us with some commissions. So we're occasionally commissioned directly by government departments to work on specific projects. We also work quite closely with NHS England, who also we've been commissioned by before, and we will collaborate with them on our work. And we also loop in with academics and charities outside of the government departments and NHS. And that might be to collaborate with them, but it also is often to include them on our expert groups whilst we're completing our analysis, to get topic expertise and feedback on the work that we do. The charities have been great that we've worked with, that have been able to contextualise some of the findings throughout the process of us completing a project, but also then when it comes to the dissemination of the work as well. A lot of them have been very vocal with the outputs we have, which has been great, because that really helps to get the message out there when we've published. And obviously we've been very reliant on and work really closely with other teams at ONS as well. So the data acquisitions and ingest engineering teams, obviously very pivotal to the work that we do. Without having the data available to us, and this work wouldn't be possible. So they're a really important team to us, and one we work very closely with. Obviously publishing as well, we need to be able to publish the data, and the media and comms teams as well. So when we get to that point of publishing, we can get the message out wide to as many audiences as we can, to ensure the results get into the right people's pockets. So in terms of how we get to the point of doing some of the work we do, often, and with most research, it starts with identifying that evidence gap, and that might be through evidence gaps that we identify ourselves, or ideas that come to us from external people, either government departments or academics. And then we work to secure funding for that work and develop the project and the project proposal in a bit more detail. And then we do the analysis and get feedback on that analysis through the process and publish the results, and that leads then on to those results being able to inform policy and spending decisions. So I'm going to go on to now a few case studies of some of the recent publications that we've had, and the impact of those publications as well. So firstly, this is a hot off the press one. So this one we published on Tuesday. So we have recently published work that's looked at the impact of employment advisors in NHS talking therapies. So some of you may know we published in December 24 now a first publication on talking therapies, looking at the impact on earnings and employment. So this project is a separate one which we've collaborated with the Support to Work project, which is funded via NIHR's Work and Health Research Initiative, and we're looking specifically here at employment advisors and the impact of those in talking therapies. So we've used data from 2018 to 19 all the way to 2022 to 2023, and linked it onto HMRC PAYE records, and estimated the effect on the probability of being in paid employment and earnings as well. So from this project, you can see on the figure here, we've seen some positive impacts of those who have sought employment advisor support alongside their therapy. So our exposure group was those who received both employment support and therapy, and the non-exposed group were those who just received therapy and not employment support. So for those not working, overall we see £105 on average higher monthly earnings 3 years after seeing a employment advisor, and a 4.7 percentage point increase in the probability of being in paid employment. And you can see that on the figure there's a bit of variation when looking at the individual groups around those who are not working. So homemakers, albeit they were the smallest group in terms of numbers, we found the highest increase in those who were not working when they saw the employment advisor support 3 years after. So they had a £219 average increase in their earnings, monthly earnings, 3 years after seeing a employment advisor alongside their therapy. We see a more negative trend for those who are employed at the start of when they see a employment advisor and ongoing therapy, with average £160 reduction in monthly earnings and 3.7 percentage point reduction following after 3 years after seeing an employment advisor. So as you can imagine, as it's only been out on Tuesday, the amount of impact we've had so far on it has been quite small, but we have had some pickup on this release in the media. So the Telegraph published on it on the day, and the overall project is by no means finished yet. So the whole support to work programme has just finished its first year. There's 2 more years of the project still to go. So for us, the next phase of this work is to look at the impact of employment advisors in talking therapies on benefits use. So that we're looking to publish in the summer, so please do look out for that release. And then further work that's conducted by the other members of the support to work team, so outside of ONS, doing some more qualitative based work to kind of understand a bit more around the impact of employment advisor support, looking at the impact on population health utilisation and societal welfare. So that's one thing importantly to note with the work that we do on admin data. We can present what we find, but we can't always see why we're seeing what we find. We don't always have that contextualised element of it. So the support to work programme as a whole is going to be able to provide that with the ongoing work packages that they have going on. But this programme of work itself is sort of new research looking at the impact of employment advisors in mental health. So it will be the first national population-based analysis of employment and support. We are currently working on a journal paper, so we will be submitting a preprint fairly soon, and we are directly informing the Joint Work and Health Directorate as well, who fund the Employment Advisors programme. So this work will have and continue to have a big impact in this space. The second case study that I'm going to talk about is one we did and published in October last year on elective care waiting times. So we're looking at what the impact on pay and employment if NHS waiting times were reduced across elective inpatient and outpatient care. So this work was originally commissioned by NHS England to inform the autumn budget last year. And we used HES data, the inpatient and outpatients data, alongside Census 2011 ONS deaths data, HMRC and PAYE data as well, to look at this. So we had a study population for this work of people who are working age, so between 30 and 59, who received treatment in hospital between April 2015 and March 2023. And we took people's first treatments per treatment specialty that they had, and we looked at the inpatient and outpatient analysis separately. So what we've done is we've had a few different stages to this project. So first of all, we calculated age standardised averages of pay and employment across the study period that we had, and used the averages to inform a counterfactual model. So what would have happened had they not received their treatment? So that's what you can see in that first figure on the screen there. So the orange line, that sort of downward linear line is the impact of what would have happened if someone hadn't received the treatment that they received. And the difference between the predicted line and the actual line is what the treatment effect is. So the dots at what the actual effect was, and the line going down is what could have happened had they not received the treatment. So for that step one, the total benefit of the treatment that we've managed to find with this analysis is around £162 billion of earnings and 772,000 person years employment. So that's the effect of treatment on its own. And then what we've done then is we've identified each patient's percentile on the observed waiting time distribution and mapped it onto a targeted waiting time distribution, keeping each person in the same percentile, which is where we see step two, so the figure in the middle. So this was based on a target distribution where the most recent year, the 92% target was met nationally, which was around financial year 2015 and 2016. And what we did then is shifted patients earlier in the distribution, meaning we were able to calculate an additional months of treatment benefit each patient would gain. And so that's where we get to the step three, and the total kind of benefit of reducing waiting times to that target period would mean an increase in £5 billion in earnings and 56,000 person years of employment. And this is likely to be a conservative estimate as well. So it's likely that that impact of that work going to a targeted waiting time could be much bigger than that. So to cover a bit of the impact from this work, as I said, this work was directly commissioned to inform the autumn budget in 2025 and has been included in the budget documentation. We published it on the King's Fund website, so there's a paper on there with NHS England to explain the work in more detail, which you can find. And we've also got two preprints out currently and awaiting publication of the analysis in some journals. Internally, we've obviously promoted this work. So our blog post on Reggie is our internal blog where we've published it. And we're also now having our methods from this work as being adopted by Public Health Wales as well. So another piece of work that we published last year was on the impact of motherhood. So this was following on from a release we did in July, which looked at the impact of adverse pregnancy events, so pregnancy loss. And so in this analysis, what we were looking at was the impact of a live birth on mothers' earnings and employment. This was a really interesting release for us. From a personal perspective, I'm a mother to young children, so have felt the impact of becoming a mother on my earnings and employment. But also it's the motherhood penalty, as it's coined in the media, it is something that's talked about a lot. And so this was a chance for us to really have a look at the impact at a population level of having a child. So what we found was quite substantial losses, really. So after a first birth, there was a loss of £65,000 in earnings over the first 5 years. For a second birth, that was £26,317, and for a third birth, that was £32,456. So we were able to really demonstrate with this analysis sustained long-term reduction in average earnings for those in employment, and on the probability of paid employment as well, which is the sort of graph with the purple dashes on the right hand side of the screen, that following a first birth, really the effect on people in employment reduces, but it never really recovers 5 years down the line either. So we don't see that creeping back up 5 years later. So there's lots more we would like to do in this space to really kind of drill into the detail a bit more. We get a lot of interest in whether we can rerun this analysis with looking at the impact on fathers. And And we also get a lot of questions around whether we could look at the impact of childcare policies as well. At the moment, we don't have plans in this space, but happy to, we are certainly kind of considering what else we can do at this point in time. But with these numbers, obviously, the results from this were it was a big number when we published it, and so we had a huge amount of coverage in the media at the time of the release. So lots of the newspapers covered it. We had a lot of radio coverage as well, and lots of charity coverage as well from organisations like Growth Spurts, Gingerbread, Parenting Out Loud, Working Families, for example. So it was well received, this work, and we also managed to have a real strong social media interest in this. There was a lot of response to this where we could see anecdotally that people had experienced this themselves, but now we've managed to quantify what we had found from this. So yeah, it was a really positive release, and we've been able to we've fed this release into the Cabinet Office, who we're going to utilise it for further kind of discussion around the Employment Rights Bill and gender pay gap as well. So then our the final kind of case study that I'm going to cover today is a little bit different, as in it's covering some of our kind of inequalities work rather than our health and labour market projects. So in January, we published a piece of analysis looking at mortality by sexual orientation. So this work has been feeding into the ongoing kind of evidence review into LGBT health. And it was to really understand like the leading causes of death and the rates of mortality by sexual orientation. You may have come across in April last year, we published a similar piece looking at the impact of suicides and self-harm by sexual orientation. So this is kind of the second phase of that, looking at sort of more broader causes of death. So you can see on the screen there that we have utilised the 2021 census for this. So that's the first time the sexual orientation question has been included in the census. And we looked at deaths up until I think it was October or November 25 in this analysis. And we produced age standardised rates per 100,000 people and rate ratios of the LGBT plus groups relative to the heterosexual group to provide relative differences in the risk of mortality. So in the first bubble at the right of the screen, you can see some of the rate ratios there. For females, there was a 1.3 times higher risk of mortality in the LGBT plus group versus those who are heterosexual, 1.2 times higher for males, and 1.6 times higher when we looked by age in the 25 to 34-year-olds. And then you can see in the table underneath, we break this down into some more specific causes of death and saw quite varying results there. So deaths from any cause, the rate ratio was 1.3 when looking at LGBT plus versus heterosexual. But if you look to the bottom of the table, the kind of starkest finding, I think, from this release was around drug poisoning related deaths, where we see a 2.8 times higher risk of mortality in the LGBT plus group versus those who are heterosexual. And then we also looked, as I said, at leading causes of death amongst the groups. So for both groups, we saw the first leading cause of death being ischemic heart disease. So that's the same primary cause of leading cause of death. But then when we look sort of at, so this is just the top 5 we put here. If you look at the second cause for LGBT+, we're then seeing intentional self-harm and events of undetermined event intent, sorry, not event, and then cirrhosis of the liver and accidental poisoning in this list, which is different to what we see in the heterosexual group. And that really aligns to the other findings we found when we're looking at the causes of death around alcohol and drug-related deaths as well. And as I said there, we've also looked at suicides and self-harm by sexual orientation, so the QR code is on the screen there for that other release. And as you can imagine with this, it's a very important topic, and so we did get a lot of again media impact in this work as well, and so there was a lot of coverage across news sites and also in the charity section as well. So just to give sort of one final example really of how we work with partners as well. So the endometriosis project, which you may or may not have heard of in previous talks from our group. But the endometriosis one has been a really interesting piece that we've done. It's one of the first ones we did in this area of kind of looking at health and employment. It published, I think it was January last year. So going back to kind of how we kind of commission and work with other people and other sectors, we identified an evidence gap in looking at the economic impact of endometriosis and sought out some funding via the Labour Market Evaluation and Pilots Fund, which was a fund run by Cabinet Office and Treasury. And we collaborated really closely with Endometriosis UK in this project. I did do a webinar in, I think it was November, the Bringing Data to Life webinar, which I'm sure is on our ONS YouTube for you can have a look at. But Emma Cox from Endometriosis UK also presented at that about the collaboration we had with her. We worked with her and the team throughout the project to get feedback on the work that we were doing, and then at the point of dissemination, Emma and her team were pivotal in some of the media interest and providing quotes and things as well, which has been great. So we obviously did the analysis and published it, and there's a QR code there for the link to the publication, and received a lot of media impact as well. So there was coverage from, again, different news sites, charity sector. We had it on the BBC, which was great. And since then, so that media impact really has been sort of at the point of release. But over the last year, we have seen it crop up again in media releases, but it's recently also now been cited in the new renewed women's health strategy for England, which was published, I think, last month or the month before. So it was great to see that, you know, a year after we published something, that work is still providing some impact and informing policy debate around women's health as well. So I've covered a bit about impact as I've gone through with those case studies, but just to sort of cover off a bit more broadly in some of the work. So as I said, with the waiting times, that's been really critical. At the point of the autumn budget, we fed that in, but overall the work that we've been doing has been critical to a decision by the NHS behind approximately £45 million allocated in the autumn budget to establish the England's Health and Growth Accelerators programme. So that programme is being piloted in 3 integrated care systems currently. As I've just covered with the waiting lists, it has been utilised into the autumn budget last year and is being used to make decisions around investment in cutting waiting lists for elective treatments. We have our analysis on motherhood, as I said, was used or has been published to be used by Cabinet Office for further analysis or policy relating to the Employment Rights Bill and their gender pay gap analysis as well. And we've had a huge amount of interest across government, academic and charity sectors around kind of the future collaborations we have. And just the kind of logos on the screen is just quite a small section of who has been interested and published around media things around our work over the last few years. So just to move on a little bit really now onto future directions and what our focus is over the next year and beyond. So I've put a selection of kind of the broad work programme. It's quite a lot of work for our team over the next sort of financial year. They won't all necessarily be published this year, but quite a lot of them will be. Our next upcoming publication, which is the first box in green, will be published. I think our date is the 29th of June. So that's the impact of cardiometabolic multiple long-term conditions on earnings and employment in England as well. So that's looking at the combination of cardiovascular disease, diabetes and chronic kidney disease, and how the having one or more of those conditions impacts earnings. We also have work upcoming with the publication date to still be confirmed, but on the impact of hospitalisation for sepsis on earnings and employment. And then to just talk a little bit about kind of the work that's just getting started. NEETs is going to be a big focus for our team over the next year. So we published in March some work looking at the impact, looking at the characteristics of people who were NEET using a census admin-based measure, so a measure different to the usual kind of ONS publications on NEETs that are done via the LFS. So it was a cross-sectional look at characteristics of NEETs. So we're following that up with a project looking at the characteristics of hidden NEETs, so people we can't necessarily identify through some of the labour market data sets like benefits data. And we're also looking at the geographical inequalities of being NEET as well, so looking at area-based characteristics and how that affects whether someone is NEET or not. We've got further work on waiting times, hopefully incorporating our benefits data and also some self-assessment data. We're looking more in the mental health space, so we have, as I mentioned, a few more looking at the impact of employment advisors on benefits use, and then broadly on the NHS Talking Therapies programme, looking at the impact of that on benefits and hospitalisation. And then also on the mental health side of things, we're starting an evaluation of the individual placement and support service, which is a employment support service for people with severe mental health issues as well. We've also got a few that are outside of the health and labour market realm as well, so looking at birth trauma and hospitalisation, and also looking at the outcomes of young people who receive talking therapies and mental health support as well. And then we have a few unconfirmed but hopeful projects that we're hoping to also be doing this year, which is more around NEETs, looking at developing an admin-based measure of NEETs, and also the impact of neurodiversity on labour market outcomes as well. And what we're trying to utilise a lot this year is new data sets that we have in ONS. So as I mentioned, we've gained a lot of data recently in the health space. So the 4 that I've kind of highlighted in red at the bottom are kind of our newer data sets that we have. So we haven't utilised these as fully as we can yet within our research. So that's going to be a big focus for us over the next year or two, is trying to see how we can incorporate these data sets into some of our projects more to be able to provide more insights than perhaps we have previously. On the labour market side of things, we've got more PAYE data and looking to incorporate self-assessment data, and using potentially rapid data is something we're exploring at the moment to be able to bring in that self-assessment data. We also now have in our labour market data available to us some information on the industry where people are working. So we are going to start looking at seeing at what analysis we can do, incorporating industry information as well. And then for our NEETs analysis and the neurodiversity work, if that's confirmed, we'll be using education data a little bit more to be able to understand our study population and build our population, knowing that if a young person is in or outside of education, but also getting things like SEN and disability status from our education data as well. But we would hope to utilise education data as much as possible as well. We would like to do some more looking at outcomes in education as well in our work moving forward. But I guess the biggest kind of projects we have going on as well, which might be of interest to a lot of you today, is around making our data a bit more available to external researchers. So within our team, we do have limited resource. We're not a huge team, but we do get a lot of interest in people working with us, which is really great. And we do try to do as much as we can with external partners each financial year. But obviously there's a lot of demand for the data that we have, but also a lot more work that can be done in this space that we just aren't able to have the capacity to do. So what we are doing over the next few years is a project that's funded via ADR UK, and that's to try and make some of this linked data asset available on the SRS. So at the moment, the data sets in scope for this are HMRC PAYE data, hospital episode statistics, births, death, and Census 2021 data. So we're looking to curate datasets and make it available to external researchers via the usual SRS process when people have a approved appropriate research proposal. And what we expect the benefits will be to that is obviously to improve population health outcomes, reduce inequalities, and inform public health policy and service planning. It will enable us to continue building some strong working relationships across government, academia, and charities, and also build trust in our ability to provide data to answer complex issues. And it will streamline access to this data, which will be a really positive thing for both us and the external research community as well. So who are we designing this asset for? So a range of people. So we'll be policymakers and analysts, socio and economic researchers and data experts as well. So we do hope to make this available in due course to you, and there is work being done this year looking at kind of doing some stakeholder engagement work around what this analysis analytical data set could look like, and so watch this space really on this work, but happy to, if there's any other questions, to put you in touch with the right people on that work. So just to summarise then, hopefully we've got a bit of time left for questions, but just to kind of summarise the presentation around what we do and why we do it. So obviously linking data across domains, across the health sector with education and economic data really does help enable evidence-based decision making across a range of sectors. And so there's a real benefit to what we've been able to achieve over the last few years and what we will go on to achieve as well. But we have really realised that collaboration has been a massive part of how we've been effective in our work. So that collaboration in that diagram I had, where we work with many sort of different sectors, we can't do it without our internal ONS teams. We can't do it without other government departments having an interest and having those policy questions that we need to answer, and having the academic and the charity sectors also being involved in the research itself, but also from that kind of topic level expertise. It really, that collaborative effort is really where we've been able to make the biggest impact and has helped driven our research forward. And then also that kind of last bit I talked about with making the data available in the SRS, I think it's really going to strengthen the potential of analysis and evaluation across government and really positively impact national and local policy making as well, which is going to be a good thing, I think, across government. So I think that's everything from me.